We're jumping into programming because Governor Polis is apparently about to announce a statewide mask mandate. He is accompanied at the podium we're about to go to by Aurora's Mayor Mike Kaufman, Denver Mayor Michael Hancock, and the state epidemiologist Rachel Herlihy. So let's hear what the governor has to say.
Beyond their population, they contribute to the overall economy of our state and the health situation of our state. We're also joined by Dr. Rachel Herlihy, the state's top epidemiologist. I want to thank her for her important work. She will give you an update. Now, the modeling that Dr. Herlihy will provide shows the uptick that we've had, significant uptick over the last few days, and show the fairly dire picture going forward if we don't change our actions and take some changes that we're talking about today, including more mask wearing and social distancing that are so important. And while we're watching the trend every day, and we hope that the additional precautions that Coloradans have hopefully taken in the last week or two will be borne out in the data in the future, this trend is alarming enough, along with additional data points about the efficacy of mask wearing that I'll be talking about later, that really justify that actions on behalf of protecting our economy and protecting the health of the people of our state. From day one, we've approached this crisis and promised to be transparent. We're going to show you how we make decisions, what the latest data is, regardless of whether news is good or bad. And I've said that we will always take the steps necessary to protect Coloradans, protect our economy, and save lives. I am, of course, glad that while Colorado is not yet a hotspot, the whole country is showing a significant uptick, and Colorado has not been an exception from that trend. And we need to make sure that we take actions that prevent Colorado from being in an uptick situation. There's a lot of news that isn't fun today. It's really important that you all hear it. You hear the data, you hear the steps, you hear the importance of mask wearing. I do want to share one positive bit of information. As you know, from the start, we set up an innovation response team. Our state has worked very hard to acquire personal protection equipment, masks, gloves, gowns on the international market, which has been extremely chaotic. I mean, literally, everybody has a buddy in Jersey. I have a buddy in Jersey. He happens to be a doctor. He went to undergrad with me. I had to call him to go check on some masks there. They didn't check out. We didn't buy them, thank goodness. But the state has been very successful in operating the international supply chains and acquiring PPE. So we want to get that PPE out, at least some of it, to support our school districts. And so today, I wanted to make sure people knew that we have enough medical grade masks that we will be able to send some medical grade masks to school districts. We will be able to help school districts meet the needs of their teachers. We're going to be able to get at least one mask per week for teacher, one medical grade mask out, even broader than teachers, all people who work in a school that face students, librarian and clerk and everybody. So districts have a lot of work to do. They're working hard. The state wants to help them reach their goal. However they run the school year. Some are delaying, some are having classrooms, some are online, some are hybrid. But masks are an important part of that mix. You'll hear more about masks today. And the state will be a partner in helping school districts have the personal protection equipment that they need to keep staff and students safe in whatever environment that looks like. So I want to thank our state team and Pat Myers and a number of others who worked very hard to be able to get enough medical grade masks that the state can help supply and help meet the needs of school districts. I know they're very hard at work to keep their students and teachers safe. Without further delay, I'll turn it over to Dr. Herlihy.
Thank you, Governor. Good afternoon. As we take a look at today's data, I want to focus not just on the number of cases that we're seeing here in Colorado, or the fact that we're seeing an increase in the number of cases here in the state, but the fact that we're seeing an increase in the rate of cases we're seeing. So we're seeing growth in the rate of increase, so acceleration of our case numbers. This figure that is shown here shows you the number of cases that have occurred in Colorado by week, and they are color-coded here to show you a visualization of whether or not cases have increased or decreased from week to week. So the bars that you see in blue represent weeks in the state where we have seen a decrease in the number of cases occurring. The weeks that are shown with red bars represent the weeks where we have seen an increase in cases in the state. And also, if you see the dark red color, that corresponds to weeks where we've seen a greater increase in the rate of acceleration of this epidemic in the state. And so if you look at our last week of data in this figure, the week of July 5th, what you'll see is that the growth in our cases has increased. We've seen an acceleration from the last week in June through the first week of July, and we're concerned that this trend is going to continue in the state. Similarly, if you look at the next slide, this shows you hospitalization data. So each of these bars represents the number of hospitalizations that have occurred in Colorado per day. And each of the colorful lines represents a different level of growth rate. So if you look at the red line, that shows you the growth rate that we experienced during the stay-at-home period of time and early during safer at home. So what you can see by that red line is that we saw a steady decrease in hospitalizations, and if you follow that red line out, we would have continued to see a steady decline in hospitalizations in the state. If you look at the turquoise line, that shows you what we experienced in the state later during the safer at home period of time, where we saw a leveling out, sort of a plateau in the number of hospitalizations occurring. If you look at the orange line, that is where you start to see an increase in the number of hospitalizations in the state, an acceleration of the increase of hospitalizations. And so what I'm showing you today is the most recently fit model to our hospitalization that is showing some pretty rapid acceleration in the number of hospitalizations occurring in the state. So that orange line corresponds to an effective reproductive number, that R value we talk about, of 1.78. The previous values you can see were just above 1 and below 1 for previous periods in the epidemic. Next slide. So here we focus in on that reproductive number, and you can see that several weeks ago our reproductive number was less than 1. 2 weeks ago it was just above 1. 1 week ago it increased to around 1.3, and currently we estimate that it is somewhere between 1.6 and 1.8. So we are continuing to see that reproductive number go up, which again represents an acceleration in the number of cases occurring here in the state. And that is similarly shown in the graphic to the right. Next slide. These figures show you the modeling data representing the number of hospitalizations and ICU admissions that might be needed in the state under various scenarios. So our latest scenario, based on the last few days of data, is shown in that orange line. Previous slide. Thanks. Shown in the orange line. So if you look at that orange line, what you'll see is a rapid increase in the number of cases in the state that could occur over the next several days. And so when I talked previously about the growth rate being important, that's really what we're tracking here. So earlier, our predictions with this model had showed slower rates of increase in the number of hospitalizations and ICU beds needed in the state. Unfortunately, what we're seeing from the last few days of data is showing that we have the potential to exceed our ICU bed capacity in the state in early September, with a peak potentially occurring sometime in October. And so being on this path is certainly a place that we do not want to be right now. We are below the level of social distancing that we know is feasible to maintain the transmission of this virus. Next slide. So this figure is showing you another trend that we are seeing here in the state, and that is a change in the age distribution of our cases that are occurring. As time has gone on, we've seen that a greater proportion of COVID-19 cases are occurring among those under the age of 40. And we also see a recent increase in the number of infections that are occurring in children, so those 0 to 19 years of age, with an emphasis of most of those infections occurring in older children and teens. Infections in older adults remain low relative to other age groups. Next slide. Similarly, adults aged 40 plus are now comprising a greater proportion of hospitalized populations. We're seeing an increase in hospitalizations in middle-aged adults in the state, and unfortunately, just in the last few weeks, we're now also starting to see more hospitalizations in older adults once again. Additionally, we know that one of the concerns that we have here in the state is the fact that we have individuals from across the state that are coming into Colorado and visiting from locations outside of Colorado where rates of transmission are higher. This graphic shows you some parts of the country where visitors are coming to Colorado. Specifically in this figure is visits to Denver County. And so you can see that there is potential risk to Coloradans posed by visitors to our state who are coming from Texas, Arizona, Florida, and other states where rates of transmission are higher than they currently are in Colorado. So looking at the number of factors that might be driving this rapid increase in cases that we've observed in the last few days, there's probably several contributing factors. We certainly know that social distancing levels have decreased, which means that there's increased contact rates among people in Colorado due to changes in behavior or policies. We know that there is probably increased out-of-household contact rates among younger populations. So younger individuals are probably starting to spread the virus to older populations. We know that those younger populations are probably mixing more outside of their home, resulting in transmission outside of the home. We know that there's the potential for importation of cases from outside of Colorado into the state and contact between visitors out of state with Colorado residents. There's also, of course, the possibility of random chance. We know that, we're looking at this data and it's based off of just several days worth of data, so we need to interpret it carefully and continue to watch the data over time. But given the trends that we're seeing, we don't believe that chance alone is explaining the findings that we're seeing currently. Thank you very much.
From the beginning, we've really talked about how my response, our Colorado's response, is driven by data, not by politics on any side, not by wishful thinking, certainly not by pseudoscience, but by cold, hard data. And as you can see, the data is beginning to be alarming. We had very encouraging data from June. Coloradans were sustaining it, but there has been some change in the behavior of Coloradans that we need to go back to how we were living in early June and make sure that we are more cautious. We need to make sure that we can continue to maintain the necessary social distancing to avoid the virus exponentially taking off in Colorado. And that's what we're starting to see now. We can still act. There is a small window of opportunity because if we don't act at the current rate that we saw, if you extrapolate that out, the state would exceed its ICU capacity in September. So that's the bad news. The good news is there is time. There's time to act right now, next few days. I hope it started already from the warnings of the last week. We are really on the knife's edge. Many nearby states have shown us what will happen. It's not what may happen. It's what will happen if we don't regain our footing and take social distancing and masks seriously. So for starters, I'm hoping that the people of Colorado, that this is a wake-up call for those who might have become a little bit lax. We need to take this very seriously. Our lives depend on it, and our economy depends on it. You're probably observing this anecdotally. You might be noticing that there's more interactions and people are a little less cautious than they were in May and June. Certainly the 4th of July weekend didn't help too. We see the effect of out-of-state visitors. We need to live here in Colorado in a sustainable way like we did in May and early June. We can't have this backslide to the way that we have all been acting these last few weeks. To the extent that there's been a party the last week or two, the party has to end. If we're going to keep our businesses open, keep our economy open, and save lives. At this point, of course, we are also focused on what steps we as a state can take to keep our economy open and save lives. Now, keep in mind the biggest factor is your behavior, reducing your social interactions, wearing masks, washing your hands regularly. That's the most important. But as policymakers, as mayors, as governors, as commissioners across our state, we always ask ourselves, what is the right thing to do from a policy perspective to make sure that we can keep our economy open and save lives? So first, a thing we're going to be announcing today is I'm putting a 2-week pause on issuing new variances to counties in the state of Colorado. That's the prudent thing to do at this moment in time. As we look at the changes that are made and the more responsible behavior that people enter into and the increased mask wearing, and hope that the trajectory changes so that additional variances can be granted. We also know that there are some areas that have variances that have increased virus. They have to have mitigation plans, or they could lose their variances. That doesn't change today. That's always been the process. But the key point is we're taking a 2-week timeout on variances so that we can get control of this. We have to get control of this in our state. We need to prevent this kind of exponential spread. The bottom line is that, like all Coloradans, I want to be able to enjoy life and go to a restaurant and get a haircut and keep our businesses open and protect our economy and protect lives. And the data increasingly shows that one of the powerful tools that we as a state have done well on but can do better on is wearing masks. And that's why today I'm signing an executive order that's effective at midnight tonight that requires that every Coloradan age 10 and up wear a mask or face covering whenever they're in any public.
We have apparently lost some of the signal from the Betcher Mansion, where Governor Polis was talking about the executive order that he is now signing effective midnight tonight that will bring a statewide requirement that people wear masks when in public indoor spaces, places like businesses and stores. Also just talking about the significant uptick that they are seeing in cases and saying it's a dire picture going forward if we don't take these steps as Coloradans and, of course, those people who manage Colorado, like the governor, and you saw Mayor Mike Kaufman from Aurora and Denver's Mayor Michael Hancock along with him. We also heard from the state epidemiologist Rachel Herlihy talking about some numbers, and they are certainly something you want to pay attention to. We do know today from some new numbers that 13 more people have been hospitalized, confirmed cases of COVID-19 than yesterday, and that takes the state's number back up to 260, and that's something that Dr. Herlihy was talking about. We hit a low as far as hospitalizations 19 days ago. On June 27th, there were only 126 people hospitalized. But as you saw in that graph that Dr. Herlihy showed us, we have been arcing up as a state, and now with 260 people hospitalized with COVID-19. We also heard him talk about no more variances are going to be granted for at least 2 weeks. It also, if you look at some of the things that have been happening in a positive light, many of them we're gauging via sports. The Major League Baseball team practicing again all over the country. The Rockies down the road at Coors Field. The NBA and NHL trying to prepare for seasons to restart, as well as the NFL looking forward. But with things trending as they are here in Colorado, you have to wonder about the Rockies' home opener in the restart being scheduled for 15 days away from now. So that is a little further, not that far off, if you will, with all of this happening. But Rachel Herlihy, again, talking about acceleration in case numbers and 4 straight weeks of growth. So serious concern coming from the Betcher Mansion, from both the state epidemiologist and from Governor Jared Polis. We will be gathering more information from what the governor had to say, and we'll be trying to reestablish the signal there to give you the latest. But the headline being, what do we have? Okay, we are not going to be able to get that signal back right away, but again, a statewide requirement for wearing masks and an executive order from Governor Jared Polis. Of course, much more on this at 9news.com. We'll have much more coming up as well at 4 o'clock. We now return to